Mouth is a gateway to systemic health, and we have known that for a long time. But we looked at it kind of superficially. You know, if you don't have good oral health, your teeth are not in good shape, you may choose food that are unhealthy, maybe softer but more sticky. They stick to your teeth. You ultimately get more cavities, more periodontal disease, and lose your teeth. Your nutrition is affected, your systemic health affected. That still holds true. We do have patients who, don't have dentures. They have to eat with their gums. You can imagine how would that affect your nutrition. They lose weight. So definitely there is an association between oral health and systemic health. But in the recent years, they have actually found that oral health has a much closer connection to systemic health. When you have gum disease, that pocket that forms around the neck of the teeth contains bacteria, and often you cannot clean it because it's deep. The toothbrush doesn't get in there, the floss doesn't get in there. You really have to spend a lot of time, use mouth rinses. There are ways to clean it, but it takes more efforts, and not everybody does it. And then this bacteria cause inflammation. Body tries to get rid of it and sets up an inflammatory response. These inflammatory products are not healthy, and they don't stay in the pocket. We may think that it's stay in there, but no, they get into the bloodstream and they go everywhere. So this ongoing inflammation could potentially cause a whole host of conditions. Now, we don't know the nature of the association between periodontal disease and certain conditions, but we know there is definitely a link. We can't say that gum disease causes heart disease, but there is an association, and lots of studies are going on to find out what is the nature of that. And the studies have shown that the nature of that connection is inflammation. So they have found having poor oral health, poor periodontal health could potentially have association with poor pregnancy outcomes, having low birth weight babies, having premature birth, having cardiovascular disease, stroke, heart attack, as you mentioned, Alzheimer, there is some association there. Diabetes, that's one of the strongest links is with diabetes. Now, what is the nature of that link? The studies are ongoing. It's been difficult to find the exact nature because we have so many confounders in the studies. Patients not only smoke, but also have unhealthy diet, but also they are overweight. So many other, maybe poor socioeconomic status. So it's hard to tease out the exact culprit, but definitely an association is there. And one thing we know is that if you keep your mouth healthy, ultimately it will pay back in your systemic health, and you are better off to keep a healthy mouth. And knowing that tobacco affects the oral health, it can potentially affect the systemic health. So that's one thing that we always use when we are talking to our patients, that you are not only dealing with the mouth health, you are potentially dealing with your systemic health.